Hello, welcome to my presentation number 6. Today we will be talking about aspirin. My name is Lauren. All right, basic information about aspirin. The brand name is known as aspirin. You have your generic name, acetylsalicylic acid, known as ASA, and it is in the drug class as a non-steroidal anti-inflammatory drug, also known as NSAID. So kind of going into our metabolic pathway here, you start off with your acetylsalicylic acid, ASA. That can be turned into the salicylic acid, SA, through the carboxyl esterase 2 enzyme. The salicylic acid can go into 4 other metabolites here. So you can go into your salicylic acid, phenolic glucuronide over here, SAPG, through this enzyme listed here. And then it can also go to this one, the salicylic acid, acyl glucuronide, SAAG, using this enzyme. Salicylic acid can also be turned into gentistic acid through the cytochrome P450-2C9. And then it can also be turned into the salicylic acid, SUA, through this enzyme here. So kind of going into more depth with our structures in this. So you have your aspirin over here, salicylic acid here, and then it'll go into all of these metabolites. Major metabolite is your salicylic acid over here. This can be turned into your SUAPG, which is also your salicylic acid phenolic glucuronide, or it can be turned into guanine through oxidation. Guanine is a nitrogenous base that makes up your nucleotides in your DNA and RNA. It can also power chemical reactions, and it is also involved in signaling inside the cell. So that's pretty neat to be able to turn into. Very helpful. All right, kind of diving into our mechanism of action now of aspirin. Over here, our normal mechanism of COX. We have COX-1. And you have your arachidonic acid right here. It'll go up into the active site of COX, and it'll be metabolized within this active site. With that metabolism happening, PGH2 is formed. That is a prostaglandin. This prostaglandin gets broken down by tissue isomerases, and it'll be turned into thromboxane A2, which will then activate platelets. So therefore, your platelets will become aggregated. Now, if you administer aspirin, what happens is aspirin will go up into the active site of COX, and acetylation of the serine will occur right up in here. Therefore, your arachidonic acid will not be able to go up into the active site. No metabolism will occur. Therefore, that cascade of creating that prostaglandin and that thromboxane will not occur. Therefore, your platelets will not aggregate. They will not be active due to just that inhibition of that cycle right here. All right. So here we have our aspirin dosages. So essentially, at low doses of aspirin, your COX-1 activity will be inhibited. Your COX-1 is mainly antiplatelets, whereas COX-2 activity and COX-1 combined at higher doses of aspirin, that's when you'll be treating it for the analgesic, antipyretic, and anti-inflammatory. So your indications to take aspirin. So if you need to use it for an anti-inflammatory, that works great. And analgesic, it is pain relief. Antipyretic, that is fever reducing. Antiplatelet, so no aggregation of your platelets. MI prophylaxis. So basically, if you suspect somebody is having an MI or they are having chest angina, whatever, you normally administer aspirin just to make sure, just in case. Aspirin usually does more good than harm, as well as having a TIA, transient ischemic attack. That and strokes. So stroke patients are usually on daily doses of aspirin, just kind of keep that antiplatelet going. Aspirin will ultimately be able to kind of help break up those platelet aggregations, those clots that form in the blood vessels. Very beneficial. your contraindications of aspirin. So usually you don't want to take aspirin if you are under 19 years old. If you have a hypersensitivity to NSAIDs, that usually isn't very good either. If you have a bleeding disorder, so if your blood's already escaping very well from your body, obviously you do not need to add an antiplatelet to it. You will just keep bleeding more and more. Recent GI bleed, those are very harmful if you also add an antiplatelet on top of it. And it is also not recommended in pregnancy unless you're experiencing preeclampsia. In some of those cases, you may take aspirin. So essentially, everybody gets an aspirin, and it's great because they are very helpful. All right, these are my references.